Welcome to Talking Health TV, where we share the stories of changemakers shaping the future of patient care. My name is Dr. Milton Brown, and today's interview explores the inspiring journey of Claire Paxman and Paxman Scalp Cooling technology. With a heart driven by personal experience and a mission to support cancer patients globally, Claire has transformed how we all think about hair loss during chemotherapy. After losing her mother at a young age, she turned her grief into a powerful catalyst for change, leading Paxman to become a global leader in scalp cooling solutions. Join us as we learn more about Claire's remarkable story, from overcoming personal challenges to revolutionizing patient care across 65 countries. We learn how Claire's determination and dedication make a difference in countless individuals' lives battling cancer. Hi Claire, and thank you so much for coming to join us today.
Thank you for having me.
Yeah, welcome. I want to start by asking you a little bit more about your own personal journey, and how did it shape your passion for developing scalp cooling technology?
So I think having cut my mum's hair off my mum was first diagnosed with breast cancer when she was only 36 years old, and the prospect of losing her hair absolutely terrified her. She did use an older, primitive type of scalp cooling, but unfortunately it didn't work for her. And at that time, when her hair started to fall out, that's when I cut it all off, aged only 14. Stood in the bathroom with those orange-handed scissors, and my mum's hair was just like mine, naturally curly, a really big part of her. So she was devastated, and that's probably one of the worst things I've ever had to do, is to, cut your own mum's hair off. So when Dad, Glenn Paxman, our founder and chairman, developed the system, I'd always sort of wanted to work on that side. I've worked for the family businesses since I was 19, so 26 years ago. I know I don't look old enough, I'm only joking. But having had that moment of cutting my mum's hair off, I'd always had that in me, that I wanted to help and to stop any other 14-year-old girl from having to stand in the bathroom and cut your mum's hair off.
As someone who's faced significant challenges, including the loss of your mum, as you've just shared with us, and managing a mental disorder, what strategies and mindsets have you adopted to preserve your personal and professional drive and determination?
Yeah, thank you for asking this, because it's something that I do feel incredibly important to talk about. We should talk about struggles and mental health struggles. So losing mum was horrific. I was only 22, mum was only 44, which is absolutely no age whatsoever. So that was really difficult, and has been one of the many reasons and a potential catalyst to my own mental health struggles. I don't think we grieved properly, didn't speak to anybody at the time. This was in 2000, so not like what we have now and the services and things. I also live with mental health disorder, borderline personality disorder, which I was diagnosed with about seven years ago. Things have been a struggle. But I'm so pleased to sit here now and to say that I'm the happiest I've ever been. And there's a lot of things that I've done to get to here. Counselling, absolutely. There is nothing wrong with counselling. It's so important. In fact, I think everybody, even without mental health struggles, should talk to people and do cognitive behaviour therapy, CBT therapy. So I've regularly seen counsellors. Mindfulness is really important. Having that time to say, do you know what, I'm going to shut off, because working within Paxman and being part of the team to elevate it to where it is now there's a lot of work gone into that, and you can sometimes, especially when it's when your name is on the business, you feel like you need to put those extra hours in, which we do anyway. But at the same time, you're no good to anybody if you've burnt out.
What about keeping fit, walking?
So I'm, again, I will admit that keeping fit has not always been at the top of my priorities up until this year. I've had major surgery this year. 2024 has definitely been my my one, but previous to that, I'll do things like paint by numbers. So sitting and having to concentrate and doing that is deep breathing, but then also walking. But then more recently this year, I've joined the gym and found that really, really, really helpful.
Excellent.
Yeah.
Can you share specific stories or testimonial from patients using Paxman Scalp Cooling system, and how these stories influenced your vision for the future of the company?
Yeah, I mean, the stories that we get are just honestly incredible, and I've personally helped so many people over the years, but that's the driver. We are a patient-centric business. Obviously, we are now public and that we have shareholders, etc. But what drives us is our patients and the impact that we've made to them. So, gosh, I could name so many. A lady who once her daughter got to sleep at night by her daughter twizzling with her hair. So that was her motivator. She wanted to be able to still have her daughter doing that. So that was, wonderful for her. We have people who have family occasions. Weddings is a huge one. So son's getting married. They want to have the hair and they don't want to be, or someone's a bridesmaid, so they don't want to be, when they look back at the photos and remember that was a point they were going through cancer and didn't want to take anything away from the bride. So, and even people getting married themselves. There's all sorts. And we talked about gentlemen, gentleman who was a captain of a golf club, never wore a hat. So he didn't want to have to start wearing a hat and didn't want to lose the stature of him being the golf club captain. So that was his motivator.
It just occurred to me, is it also for young children as well?
So most young children's cancers are hematological cancers, so in the blood, so leukemia, etc. And it can't be used for those, it's contraindicated. However, sadly, there are some solid tumour cancers which young people can get. So with the youngest I've treated with a cervical cancer was a 14-year-old, so they used it. But you can be as young as 17, 18 and have breast cancer. So we do provide they can have access to it. And we actually work with Project Youth Cancer, the fabulous local charity who used to be called Laura Crane, and we actually provide a service to teenage and young adult units around the UK so that they can access scalp cooling free of charge. It absolutely is our goal. We want to democratise scalp cooling. So no matter who you are, where you are in the world, your cancer type, your ethnicity, your gender, that you get access, and your financial situation, that you absolutely get access to this treatment.
That sounds really wonderful. And something else just occurred to me as well is, do you work with the elimination of cancer, or is it just more or less trying to help people who have cancer?
Yeah, so we do. We are. It's side effect management. That's what it's classed as. So we don't work with the treatment of it, but we're trying to help people whilst they're going through that. As I say, that side effect management. But we're working with some of the global leading cancer institutions all over the world.
It must be exciting.
Oh, it's honestly, when I moved over from our sister family business, Brewfit, in the drinks dispense industry, because that's where all this came from, you see. So when Mum had scalp cooling, she was offered, as I said before, a rudimentary type of scalp cooling treatment. And that's when it didn't work, that's when Glenn asked the question, why hasn't it worked? What are you trying to do? And explaining that you're trying to reduce the scalp temperature and maintaining it that without having to change caps, without having to use excruciating temperatures. That was I always call it his light bulb moment, because we've been cooling liquids in the drinks dispensing industry since the 1950s, which is when my grandfather invented the first type of ice bank beer cooler. So that's that's where this has ultimately come from. So when I used to work on Brewfit, and when I moved over, we were in 30% of hospitals in the UK, only distributing to a handful of countries, and there were 6 of us. Six of us that worked, and now 2024, coming to the end of it, we're distributing to over 65 countries worldwide, and we now have over 100 team members globally for Paxman. So yeah, there is a lot of pinch me moments.
Yeah, I think it says a lot about the product, but also more importantly about the people who are working in the organization as well. Yeah. A listener and somebody who's been tuning into Talking Health TV, we put out that we was going to be interviewing you soon, and she said that she had stage 3 cancer. She was offered the scalp cooling hat.
Yeah.
She put it on. It didn't fit right. It felt uncomfortable. She never got much encouragement by the nurse to persevere with it. She took it off. And then she listened to you on Dr. Liz O'Riordan's show. Yeah. And she's regretting that she didn't persevere with it. So I guess the question she was asking me was really about what training do the nurses get? Because you just shared there that it trickles down, doesn't it?
Yeah.
And what other advice could you give to patients like her?
Yeah. So again, this is one of the many reasons why we've invested in improving our training provisions, so that because there are we're in nearly 100% of public and private hospitals here in the UK. So it's not always easy to capture everybody as well when we are going and having the training visits, because we're actually going and providing the training when they are in their normal working day. So there might be 10 people on that unit, but we only get to see 2 or 3. So that's why, by improving them and having the training platform, we can then ensure that we can capture everybody. That's why I developed Clinical Pioneer Program as well. But one thing that we always do say, and which is really key, is for patient advocacy. So we have a close Facebook group that's now got 12,000 members on there, really supportive network. So we do try and encourage people to join that. My social media has also got some really helpful videos, and we're always here to help and support. So if anybody's not quite sure and actually just feel like they need that little bit more support and guidance, do get in touch, because we're always here to help. I'm the big sister of scalp cooling. I'm here to help and support people.
Yeah, and last point on this is then just to kind of give to reinforce the importance of sticking with the scalp cooling hat.
Yeah. So there's a couple of things, as I just alluded to before. It's not just about the retention of your hair during the chemotherapy anymore. We have there's certain types of drugs that we do have low efficacy rates, and sometimes that's when people then have perhaps been dissuaded or said, well, it's not, it's coming out now, it's not really of any benefit to carry on. But that's not the case anymore, because, as I say, we now have clinical data that proves that if you continue scalp cooling, even with significant hair loss, you are still protecting those hair follicles to the point that the hair will grow back thicker and faster within 12 weeks. So people can be like 4 to 5 months ahead. Another area that we've just done a campaign in Breast Cancer Awareness Month, is that we're really trying to raise the profile, or not the profile, sorry, the importance of the fact that there is something called persistent chemotherapy-induced alopecia, so PCIA for short. Now, if people are receiving a high dose of a drug called docetaxel, they have between a 10 to 30% chance of their hair never growing back, which is devastating. So we're really trying to get that message out there that this is actually a thing, but then also the fact that it's actually been shown that scalp cooling can mitigate that risk. So therefore, people on a high dose of docetaxel should be offered scalp cooling in order to mitigate that potential risk.
Wonderful. Paxman operates in over 65 countries. What challenges have you encountered in ensuring scalp cooling technology is accessible to populations worldwide? And how have you addressed these challenges? So 65 countries, so let's say Africa, the Americas, Europe, etc. So, and we know different ethnicities have different strengths in their hair in terms of the context of their hair and how it grows. Straight hair in perhaps European countries, curly hair in perhaps African countries. How do you get the scalp cooling to be that flexible between different hair types?
So we haven't always been right. And so in terms of the growth, you obviously have to look at different markets and adapt the business model to that market. So, for example, in the US with insurance, we've had to do different things there. And then when you're dealing with the Middle East and all of these different markets, it is absolutely important that you do your due diligence first before you enter into that market. In terms of your question with regards to efficacy, so we a few years ago recognised that actually we weren't being inclusive at all in our guidance and our hair preparation guidance. And also there is a myth that scalp cooling doesn't work for people of colour. And that's not the case. What is really key is hair preparation. So I work very closely with a wonderful UK charity called Black Women Rising, who set up by the fabulous Leanne Perro MBE, and looking at the health disparities for women and men of colour. And they did a survey, and one of the things that came out of that survey is that it said, and even scalp cooling, the hair preparation techniques are not inclusive. So that made us, we understood. We would never not look at that. And so it really made us think, oh, hang on a minute, So we're telling people with type 3 curly and type 4 coily or afro hair to put water on it and put conditioner on it and then push it back. Well, no, that's not going to work because of, like you said, the texture. So the water, if it's high porosity, it's just going to run off. But also, if you apply water to certain types of coily hair, it makes it more voluminous. And what we're trying to do is get it as flat as possible so that we can get as close contact to the scalp with that coat cap. We need conditioner to be able to remove it, and we need to add water to help with that, the conductivity, so the heat transfer. So we did lots of research and spoke to people, experts in hair type, and that's why we now have separate guidance so we've got guidance for people with type 1 and 2, your straight and wavy, and people with type 3 and 4 hair. And we do actually have a trial ongoing as well in the US looking at the efficacy. But anecdotally, by lots of people on the Facebook group, we're seeing some fantastic results. Now people are adapting or adopting, should I say, the techniques that the guidance that we've now provided.
Okay, thanks for that, Claire. Can you share some things about your home healthcare division and how you've expanded that?
So the home healthcare division is where patients in the UK can access scalp cooling in the comfort of their own home, as long as they have private medical insurance. So there are a couple of companies that do this now. And again, as I mentioned earlier about us ensuring that we want to make scalp cooling accessible to everybody. So this is something that we set up back in 2012. And so we work with both of those companies and literally deliver our scalp coolers to people's homes so that they can still have the treatment.
And what's the vision for Paxman on the horizons? Where next?
Where next? Yeah, so it's very exciting, incredibly exciting times. The biggest thing recently is for the US is actually, not to go into it in too much detail, but insurance. We have an insurance-based billing model in the US. So traditionally it's been self-pay over there, so where it's out of patients' pockets. There are lots of there's different charities that have set up to help with the costs of that. But more recently, it was granted CPT coding, which the CPT coding was classed as temporary. So it's been difficult, but that it has seen a level of coverage. And we've been getting our current users from self-pay over to the IBBM, our insurance-based billing model. But some incredibly exciting news recently, over the last couple of weeks, is that it's now been granted a CPT-1 code, which means it gives it it's a permanent code, and it gets a value put next to it, which means that it's not just about Medicare, Medicaid, which is like the government-led insurance. It means now as well that there's a lot more of the private insurance companies will adopt and will pay for it, which obviously means much greater access. So that's really exciting. We're doing lots of work behind the scenes as well in terms of the research and development, topical agent to help improve the efficacy of scalp cooling, no matter what drug regime that you're having, and launching of our next device, which is to help with peripheral neuropathy.
Okay, my final question is, so what are you getting out of this as well? Because I feel the passion, the excitement, the motivation, the aspiration you have for the company. What is it doing for you as Claire?
Everything, even in my darkest times, the fact of what we're doing at Paxman has been the catalyst for me to keep going, because it absolutely means the world. This is my mum's legacy. Absolutely is my mum's legacy. But everyone that works at Paxman is got the same vision and the same energy as well. And so I love to be able to spread that around and Paxmanize people when they join. Paxmanize people when they join the business. But yeah, it's very different now to what it was, many years ago. But my God, it's exciting, and I get to do this with Rich, our fearless leader, our CEO. My fellow SLT members as well. It's just awesome.
And I want to say a big thank you on behalf of Kirkland's Local TV for taking time out to come in and seeing us. And I wish you all the very best, and hopefully we'll catch back up with you in the new year to see how some of your trials are going and everything else. Please keep sharing your story of Paxman. We'll keep looking out for Paxman as well.
Thank you.
And come back and join us here sometime in the new year.
Absolutely love to.
Thank you so much.
And thank you for having me.
And to you, our audience, thank you for joining us in this enlightening conversation with Claire Paxman. Claire's story is a testament to resilience, compassion, and the relentless pursuit of making a difference in healthcare. As she continues to champion scalp cooling technology, Claire reminds us that behind every innovation lies a deeply personal journey and a commitment to improving the lives of others. We hope her insights inspire you as much as they have inspired us, and myself included. Stay tuned for more stories for change makers shaping the future of patient care. Bye for now.